Ashley Skipper, and this is my poster presentation on dementia patients' quality of life. My PICO question is in patients with dementia, does long-term nursing care facility option improve patients' quality of life compared to home health care option? And to come up with that, I used the PICO formula, and it's patients with dementia, the intervention, long-term nursing care facility, comparison, the home health care, outcome improvement of patients' quality of life. And over here I have my table, which is, I looked using 3 databases, Medline, ProQuest, and CINAHL. And the keywords I used was dementia patients, quality of life, long-term care, and home health care. Some of the limits I used was the article published within the last 7 years, meta-analysis, academic journals, human species, subset would be nursing journals, full text articles, and English language. That would be under the Medline one, and I got 360 articles. Under ProQuest, I used the same keywords, and I had to be published within the last 7 years, scholarly journals, case studies, the human species, full text articles in English language, and I found 1,048 articles with one of those keywords in it. And then the last database I used was the CINAHL, and I used the same keywords with it also, and I used published within the last 7 years, clinical trials, meta-analysis, systemic review, human species, subset nursing journals, full text articles in the English language, and I found 5,308 articles with one of those keywords listed in it. And then here I have my critiques. My first critique is an article that was a cluster randomized trial of staff education to improve the quality of life of people with dementia living in residential care. The point of the study was to determine direct educational interventions for staff, if they were effective in helping improve the quality of life and the life of patients with dementia. The research was done in 39 residential care facilities with 351 residents that were 65 years and older, and with the mini mental examination score less than 24. The quality of life by the participant, him or herself, next of kin, and staff were who answered. The results of the study was the quality of life of the participants with dementia were not associated with the educational interventions, and the participation of staff in the educational interventions were low in attendance. My next critique was out of the Journal of Clinical Nursing, and it was an article assessing the quality of life of older people with dementia in long-term care. The study was comparing 2 different types of questionnaires and assessing the quality of life of dementia patients. One questionnaire was the Dementia Quality of Life and the Quality of Life Alzheimer's Disease questionnaires. The Dementia Quality of Life questionnaire is a 29 question with a 5-point scale, and then the Quality of Life Alzheimer's Disease questionnaire is a 15-item questionnaire with a 4-point scale. They also use the mini mental state exam to assess the cognitive impairment of the dementia patients. And the results of that research has found that the quality of life Alzheimer's disease questionnaire had a higher completed rate compared with the other survey. And I think it was due more to the more cognitive impaired the patient was, the harder time they had finishing the Dementia Quality of Life survey. The other critique was the journal came from the the Journal of Older People Nursing, and it's an article on is the quality of life being compromised in people with dementia in long-term care. And this is really on different things that can affect the quality of life of patients. And one of the big things was knowledge transfer, of transferring the knowledge of dementia into our practice. And that found to be a big thing, and it outlined strategies to improve the knowledge transfer and for nursing staff, because that's the majority of people who care for the patients with dementia, and they make a big impact on the quality of life of dementia patients. So, and I have here my introduction of how I would use this in my practice, and knowledge would be a big thing to take away from what I've researched is education in dementia and different strategies to help patients to better their quality of life, and maybe see what type of programs at my facility we could offer to our staff to better help the patients. Although some barriers I could see would be lack of attendance, like the one research, because it's hard now to get people to even do their CE certificates. I could see that could be a big issue. And also consistency with each staff member. So to perform these surveys.